Good evening students, welcome back to our channel Ach'z. As you know, today we had OET exam. So here comes the complete review or the question paper discussion of OET exam. And we are going to discuss about 2 to 3 different set of question papers which we collected globally. Okay, so if you got any other question booklet in the sense, try to comment that below. What all things you remember, try to make a comment over, then others will also be benefited from that. So without further delay, let's start with our section. Coming towards the first module reading, in that the first set of question paper, part A about pneumonia, and in that the test A includes the definition and causes like bacterial, viral, fungal, etc. And the test B about the signs and symptom and even diagnosis, and test C about the treatment guidelines, and the last test D about the prevention strategies. In that they mention clearly about vaccination and hygiene measures. So that's about the part A, and in that the C1 and C2 include personal protective equipment, or we can say PPE, and also about the hospital policy. Now coming towards the set 2, it's about botulism. I think recently they asked this particular passage. Maybe the center will be different. So in that the test A including definition and types of botulism. In that they clearly mention about the foodborne, wound, infant, then inhalation, different types and all. Then in test B, it's about signs and symptoms. Test C about the management. In that they mentioned about immediate antitoxin, antibiotic, supportive care and all. Then last test, antitoxin dosage for different age groups. So that's in a table format. And in that the C1 and C2 including CPAP and also about the cardiac medicines. And one another set of reading we got, that is about the carpal tunnel surgery. And in that the test A including patient information leaflets about the post-surgery care and all. Then test B about medicinal guidelines, indications and contraindication and even risk of the procedure. These all things are included in test B. And test C about the research summaries. In that they mentioned about the success rate, outcomes and even techniques. And test D about clinical notes. In that C1 and C2 including patient engagement and also diet heart hypothesis. So that's about the 3 different set of question papers under reading module. So I hope you got a clear-cut idea about the today's section. So try to watch out the review videos if you are planning to give your OET in the upcoming months and all. Then you can know about the trend or what type of passages or what is the level or what is the content you can expect in your real exam. Now we will move towards the second module, writing. First set of letter, it was a reference letter and the case, non-case of diabetic. The patient name is Mr. John Anderson, 58 years. They given the address and all other information. Patient got diagnosed with diabetics 5 years ago and on metformin and also lifestyle modification. Now the patient is complaining for mild dizziness and occasional numbness in feet. So the community health nurse want to write a letter to the doctor or the GP for blood sample collection and test, and also for the further assistance. So that's about the first set of letter. Now coming towards the second letter, again the reference letter. Today we collected all 3 set of questions. It's the same pattern, reference letters only. So try to understand the trend. Okay, if you are planning to give your exams by the next month and all, means reference letter you need to concentrate more towards. So here again the patient GP, we need to write a letter to the patient GP. It's like a mother and child case. During the home visit, child is unwell with fever, cough for 3 days. The history, no known allergies, and vaccination is also up to date. The current signs and symptoms including mild dehydration, reduced appetite, persistent cough, and also intermittent fever. They just mention it as 38.5 degrees Celsius. And in case of management, advice to increase the fluid intake, then paracetamol for fever and also to take rest. So in the reference letter, you need to request the follow-up appointment with the GP for the further assessment. So child's name, yeah, they mentioned Emily Colleen with 2 years. Now coming towards the third set of letter, again referral letter only. Patient name is Mrs. Olivia Parker, 17 years, suspected anorexia nervosa. Reason for the referral is significant weight loss, a refusal to eat, and excessive exercise. So in the history, they just clearly mentioned about progressive weight loss over 6 months, body image concerns, and also social withdrawal. So the management so far, nutritional advice, encouragement for this parental support and all. So we need to write a request to the specialist assessment and the possible intervention. So that's about the 3 different set of letters so that we collected from students globally. Now we are moving towards the third module, speaking. In the first set of role play card, it's a mother and child card, hospital ward, that's the setting. Child has just undergone an adenoidectomy. You need to provide discharge instruction and answer for the concern. So in the card, you need to specify, explain the post-operative care at home, provide guidelines on diet, activity, and also the pain management. Then inform the parent about the potential signs of complications and reassure and address any concerns. That's about the first role play card. Coming towards the second role play card, the setting is community health clinic. Patient came for the routine checkup and mentioned a hearing problem. Patient is concerned about the hearing impairment. Then after this assessment, the patient identified with potential hearing issues. So you need to advise the patient on the next steps. That means including seeing the doctor for this further assessment. Then coming towards the third role play card, the setting is hospital ward. You are attending a patient who has just had abdominal surgery. So you need to explain the post-operative care, including the wound care and the pain management. Then address the patient concerns about this diet and mobility and reassure the patient about the recovery time and even answer to all the questions. Now coming towards the fourth role play card, setting is pediatric clinic. Nurse is speaking to a worried parent whose child has a high fever. Reassure the parent and explain the common causes of fever or the type of fever and all. Then provide guidelines on this home care about the hydration, fever management, and when to seek the medical attention. About the patient condition, if there is any complication, means want to seek out for the medical attention, and address any misconception about the fever or the care of the child and answer to the parents' questions. So that's about the fourth role play card. So as I mentioned before, if you got any other cards, means try to mention that clearly in the comment box. Now coming towards the listening set. In the first set, the part A including the talk with the dermatologist and the patient about the skin condition. Then the second part including talk by a nurse, briefing about the patient discharge instructions. And part C including talk by ED physician about the stroke prevention. And the second set, the part A including talk with the GP to the patient about the care of back pain. And the part B including the senior nurse giving instruction to the junior nurse about the handling of the aggressive patient. And the last part about the physiotherapist talking over post-surgery recovery. So that's about the 2 different sets which we collected. So I hope you understood about the pattern or the type which is very common nowadays. So that's it related to the question papers which we collected for today's exam. So I hope you all attended well. All the very best for your results, and try to comment over your experiences in the comment box. So thank you so much for your time over here, and God bless you all.